I'm Professor Howard Thomas. I'm Professor of Medicine at Imperial College. Hepatitis C is an inflammatory condition of the liver that ultimately results in cirrhosis and primary liver cell cancer and is caused by a blood-borne virus that is transmitted from someone who's already got the virus in their blood. Usually it's transmitted at the time of the medical procedure, or if someone's using intravenous drugs, at the time of tattooing, or occasionally prior to 1991 by transfusion of blood or blood products. The big problem with hepatitis C is that most people don't have any symptoms, and the infection goes on for 20 or 30 years, and then only when you develop cirrhosis, which is a serious form of scarring in the liver, which also puts you at risk of developing primary liver cell cancer, only at this stage do patients actually have serious symptoms. And the symptoms at that stage are usually lack of energy, the problems that occur with cirrhosis, which may be swelling of the abdomen and jaundice. And about 80% of people infected, they develop antibody and then they develop persistent infection. And we determine that by what we call the hepatitis C virus RNA test, or PCR test, which detects the nucleic acid of the virus, the insides of the virus. If a patient has antibody and is HCV RNA positive, it means that they've got the chronic infection, and then we want to know really, has it caused any problem to their liver. Initially we would do liver function tests, which involve just a straight blood test, and that tells us whether there's any destruction of liver cells. Then if we want to look at the cumulative effect of the virus over many, many years, we have to have a way of determining how much scarring there is in the liver. And this can be done most accurately by liver biopsy, which is a technique where we pass a needle into the liver. It's done as a day case. The patients go home after the first 4 or 5 hours, and it gives us a tiny core of tissue to look at under the microscope. There are 6 or more types of the virus, what we call genotypes, and the importance of determining which genotype the patient has is that some genotypes need 6 months treatment and some 12 months of treatment. I mean, treatment is as an outpatient. The patient initially will come up to the hospital at weekly intervals while we work out the appropriate interferon dose and we get the patient started on ribavirin. And thereafter they'll come up at progressively longer intervals as they become accustomed to the 2 drugs. 2 things do affect the response to treatment. The first is whether you continue to take alcohol, or if you've been on intravenous drugs or methadone. Those things need to come under control.